And thank you. I knew I would forget that recording always, right? It's the one thing. So we have had a really busy week of raising awareness around this issue. And I know many on this call have been doing really wonderful work in their local communities. And as we move through our conversation today, we will have time in groups to talk about that, all of the work that you've been doing and swapping ideas and doing that kind of learning and sharing. But first, we are going to walk through a little bit of level setting and just information for all of us. As you know, we know that there are new people to the space, folks who maybe aren't familiar with our coalition or the work that we're doing. So we are going to do that first, and then we will jump into breakout rooms in a little bit. So if you are just joining, you're welcome to drop your name and where you're coming from in the chat, whether that's your organization or where you're physically located, whatever you feel like is helpful for the group to know. All right, so we're gonna jump in here and get started. So if you're not familiar with our coalition, we got started in late 2020, really as this response to what was going on in the pandemic, and knowing that this has been a long issue, isolation and loneliness for the folks that we're working on behalf of, or maybe even identifying with. And the pandemic really gave us this unique opportunity to address this issue in a new way and convene partners. And so that's exactly what we're doing, is we're getting organized and addressing this issue with a statewide coalition. We have a monthly meeting structure. So some of you in this call are participating in that monthly meeting, and you all are invited, of course. So if you're interested in getting more involved, we do meet monthly. And then we also have work groups that meet roughly monthly. They're all a little bit different, and they focus on policy and advocacy, research and measurement, detection and access to resources, health equity, and raising awareness. And a lot of the work of this week, this awareness week, has come out of the Raising Awareness work group. So that's really where a lot of the work, I guess you could say, because it's a work group, happens on behalf of this coalition. And then those monthly meetings are an opportunity to align around what's going on. We also have a listserv if you maybe don't have the capacity to jump in at a really at that kind of level. And if you're interested in any of these things, please definitely get in touch. And as we go through the meeting, we can drop in our interest forms into the chat. So as I mentioned, this week is Social Isolation and Loneliness Awareness Week. And in the past, the coalition has done activities around this week, but each year it gets bigger and bigger. And this year we had a webinar on Tuesday centered around volunteering and the connection to our issue. And then today really is a chance to talk about what's going on in our state and how we might move forward. So it's just a really exciting time to be a part of this, especially as we head into the holidays. All right, so for folks who maybe are newer to these concepts, just to kind of set some definitions for us so we're all sort of speaking the same language, if you will. So social isolation is really defined as this objective measure of the number of contacts folks have. And it's not always unpleasant for someone. It can be really unpleasant. But we all maybe know folks in our lives, or maybe we ourselves don't necessarily require lots of social connection with others, and it varies based on what your preferences are. So it's really that objective measure. And then closely interwoven with that experience is loneliness. It's that feeling that, many of us can identify with, particularly, coming out of this pandemic experience that I hope we never have to experience again in our lifetime. But it's that feeling of, the gap in what you'd want for your level of social connection. It's really quite distressing and has a lot of health impacts, and I'll get into that in a second. And then the last definition that really gets thrown around in the context of this work is social connectedness. And that really is, the ideal level of social connection that you want as an individual, and you have the ability to attain that. And so That's really what we're striving for. If we had ultimate social connectedness, we wouldn't necessarily have to talk about loneliness. And so, we're really centered around that concept. So the public health impacts related to this issue, and I, won't go through every single one of these. And like I mentioned at the beginning, we are recording, so you're welcome to come back and check this out. But we do know quite a bit about the impacts that isolation and loneliness have on our health. So in that first bucket, we've got physical health, and really those are our chronic diseases, things like cardiovascular disease or type 2 diabetes. There's a lot to do with our economic health as well. So, we see increased Medicare spending, lower productivity, possibly increased absenteeism. And then, of course, connected to all of this is our mental and behavioral health. So things like increased risk for depression and anxiety, or maybe, increased addiction. And then last but not least, of course, is that cognitive decline and, that connection to dementia and Alzheimer's. Our measurement and research work group put together this really awesome model. And if you are like me, you really like models. And I also know there are many folks that this could feel really overwhelming. So I will go through each layer of this. But really what we were trying to do is understand what are the different risk factors that, make us possibly have the experience of isolation and loneliness. And so what they did was they mapped the risk factors that we know of documented in the research to these different tiers. So you've got individual, relationship, community, and societal. So when we think about possible risk factors for the individual level, we broke this out into personal characteristics and then life course transitions. And again, I won't go through every single one of these, but you can see a personal characteristic of being an older adult, or being someone who has a disability or maybe experiences depression and anxiety are all risk factors for increased risk of loneliness. And then that second bucket is life course transitions. And we all probably can identify with or know of someone in our life who has gone through a major life course transition. So, maybe developing dementia or retirement, even losing the ability to drive. All of those different kinds of things really put us at risk. The next layer is connected to our relationships and relationships with others. So risk factors would be like proximity to neighbors and your size and quality of a social network, or possibly your community involvement. So different things that, are outside of things individually happening to you, but are in relationship to others. The next level is community. And this would be something like if you live in an area that has, limited opportunities for social participation or recreation. So maybe that's not something that's really built out where you live, or, maybe your access to services is low, or your public transport. Maybe you aren't able to access public transport because of the type of accessibility needs that you have. So these are the type of things that are connected to the decisions we make as a community and can really make it harder for folks to engage in the way that they would want to. And then lastly, really, it are these big wicked issues that we see across many areas of our world and in our country. And so, these particular societal issues show up in many other places as well, other issues that we may work on. And they show up here in our issue too. So really that stigma of loneliness, I hear about this a lot from folks, just really not wanting to talk about that they might be experiencing this. And this really ties to our cultural values of independence and productivity. And we may kind of think of times in our life when we've heard folks speak to those cultural values, but that can really serve as a barrier for our ability to lean on each other and connect, because we may feel like we have to do it all on our own, when in reality, we do need each other, and we do need to lean on each other to be healthy. And then other notable ones are, discrimination or marginalization, and many of the isms we see, like ageism, ableism, or racism. So closely tied into this issue is that, social isolation and loneliness is not a personal choice. I think the folks that you all probably work with and the folks we know, people don't typically choose to feel lonely. That's not generally what they're wanting, right? But it's really something that's rooted in our community design and what kind of decisions we make as a society. So down below, there are different examples of system design that lead to isolation and oppression of communities. And I like to give the example that, where I live many, many years ago now, there was a decision to build a highway splitting up two different neighborhoods that had lots of families that lived on both sides, and they, would go back and forth. And a highway was built through the center of it, making it harder for those families to, easily and safely get back and forth. And really that highway was built to get folks from the suburbs into the city. And in that decision, really cut off the social connections between those groups. And honestly, that highway has only gotten larger and larger as the years have gone on. And I would not personally feel safe crossing it. And so you think about how that one, transportation decision really has impacted the way that these families and communities are able to connect. Another example that folks bring up a lot is like how we make decisions around our parks and community spaces, and do all folks feel safe and like they belong in these spaces? So there are many ways that we make decisions and place priority on different things, and it's directly connected to how people experience isolation and loneliness. So you might be wondering, how do we then create socially connected communities? And there are a lot of really great recommendations out there around this issue. And so later, after I'm done sharing my screen, I can drop a link to a report in the chat that this content is taken from. And it's really wonderful because I feel like it gives some high-level recommendations, but then dives into, some sub areas that are a little bit more specific. So if you're, wondering, where do I even start? That would be a place to sort of lean in and think about what kind of partners you might need to get something like this done. So the 5 main recommendations, and, based on my examples before, we talked a little bit about, the different connections to these, but first is design and maintain and activate inclusive public spaces. So, that would be designing safe spaces for all together, and making sure that public spaces do encourage healthy social interaction. I previously worked in an area that was doing a redevelopment. And one of the main priorities that came out of the community engagement that we did was that folks really wanted to make sure that that development created spaces where the folks that they were living near could come together more easily. So it's definitely something that people want. Number 2, prioritizing connection and transportation systems. We talked about that one a little bit. Number 3, constructing housing environments that build community. Number 4, investing in inclusive practices and community-led solutions. So really using our engagement strategies to make sure that, the decisions we're making are serving the people that are going to benefit from them. And then lastly, make social connectedness a community norm. And that's really something we're working on here in our coalition, is making sure that when we are talking about isolation and loneliness, we're talking about striving for that ultimate social connectedness and setting that up as an expectation in the work that we do. So just to kind of share this quote with you all, some of us saw this quote when we have been doing this work and really felt like it identified with what we're trying to do. And I'll read it to you in case you are not able to exactly see the screen, but it says, connection builds a virtuous cycle. When people feel valued and cared for within the community, they are more likely to contribute and participate in creating healthy, equitable places. And we know this is true in data as well. We know that folks that volunteer more, based on our conversation Tuesday, we know that folks who engage in their communities and vote are healthier and they have better health outcomes, and it creates the cyclical circle where people want to contribute and be a part of their community. So next up, we wanted to share a few national resources that we included within our toolkit for this week. And if you haven't seen that toolkit, definitely reach out. We're happy to share that with you. And just, wanted to highlight some things that, maybe in our toolkit show up as a lot of different links. So I wanted to really spend a little bit of time so that you all know what's out there at the national level and things that you can lean on. And of course, this is not, these are not all the resources that exist. These are just a few that we wanted to highlight, and know that there are many resources out there. And, as you come across things in your work that you feel like are really helpful, definitely share that back with us so we can include that in materials that we send out. But the first one that we wanted to highlight was the one at this one here on the left side of your screen, and it says Connect to Tools to Overcome Social Isolation. And this is a tool that, and again, I'll drop these links in the chat as soon as I am done sharing here, but this is a tool that if you're working with individuals that maybe you want them to be able to do a self-assessment on where they're at, or maybe you yourself kind of want to know, where am I at with my level of social connection? That's a tool that can be really helpful that you can page through. And then on the lower part of your screen, it's a screenshot of the NIH, National Institutes on Aging. This is a resource that has tips for staying connected, and it's got a lot of really great information and then also some templates. So, in our toolkit, we tried to create some templates as well, but there are more that are out there that you could modify and use based on your own work. At the top there, it has kind of like a light green background, is a screenshot of the Engage Social Engagement Innovations Hub. And this is a really cool resource. You can go in and see different things that folks have done across the country if you're looking for ideas. And then there are different tags that, indicate, maybe population or type of activity. So you could filter out how, what you might want to be doing. And so definitely encourage you all to submit things if you're doing things in your community to this hub. And then, it'll only be better because we've got more things linked in there. And then last but not least, we've got findhelp.org. This is a cool resource where you can type in your zip code and it will direct you to different types of help, and you can filter out, what you might want help with. And it goes beyond just isolation and loneliness. So for those of you working with folks who maybe have multiple different things that they're looking to have support on, you can, get lots of different types of help within that website. So just a really good general resource there for you all. So those are some of the national resources that exist. And today we're hoping that we can spend some time learning from each other and building out, what is going on in our state and what are the things that, we can really look to as good ideas and how people are addressing this in their community. So we're going to spend the bulk of our time in breakout rooms, actually. And we've got different facilitators here that are part of the coalition that will help support your conversation and move through some of these questions. And really, our intention is just to have time to learn from each other, network a little bit, celebrate if you've had any successes or things that, you've been challenged by, and just learn a little bit about what's going on across our state. What are those innovations and initiatives that are happening? So we are going to move into breakout rooms here in a moment, and I'm going to stop sharing. And I suppose actually before I jump in, if there are any questions before we move into breakout rooms, happy to take those based on the things that we just talked about.
Carly, I have a comment. I don't know if anybody else got it. but it was about how sometimes older people lack trust in their community, and how do communities build that trust. I'll just read it. And I think it's something that could be discussed further in some of these breakout groups. That's why I'm just going to share it. Community needs to have trust and safety. And how do we include that as we take this into consideration? As people age, it's hard for them to trust people, and for good reason, or they are vulnerable when social. Not sure how this fits, but I think it's a great point, and it's worth even having some more discussion around as a coalition as we talk about providing tools to communities, and if we can provide tools that do help with building trust. So
yeah, thanks, Sarah. I think that's a really great comment, and maybe if folks are interested in exploring that more in their breakouts, or if there's anyone who is a part of the group right now who maybe has experience in building that kind of trust. And, you know, I can think of a few ways that I've seen others do this really well. And I think it comes down to, you know, building those relationships, and in particular with folks that you maybe already have a relationship with, or through a community group that has a relationship with that particular person. Or, you know, another thought could be like, you know, making sure that the folks that you're trying to build a relationship with maybe look like you, or can identify with things that you've gone through, so that makes it a little bit easier to build that relationship. But definitely encourage, if folks want to go down that path in your breakout rooms, please do. All right, I am going to drop these questions in the chat so that you have access to them. And our plan is to be in breakouts. Just getting a little bit of feedback there. Our plan is to be in breakouts for about a half hour. And definitely let me know if you need anything. There are those questions for you. Once they open the rooms, you'll get randomized into a room, and then your facilitator will join you. So, oh, and then I forgot to mention, when we come back, I'll ask for a few folks to just kind of share a little bit about if you've heard of, you know, any good ideas or things that, you know, if you think are worth mentioning for the broader group. So here we go. Here are the breakout rooms. Are they going? I don't see anyone moving.
Not yet. This is Laura.
Okay. Let me try this again. You all.
Really, it looks like they're not assigned to a breakout room.
Weird. Okay, let's try this again. Thank you all for sticking with me. Okay, one moment. Definitely, if you want to take a little stretch break or grab a glass of water, we will get this figured out here.
Carly, I was in my breakout room and then nobody came, so I came back.
Thanks, Chris. Yeah, it looks like folks didn't get assigned. So looks like it's set to go now, and then facilitators, I will move you into the room. So hopefully now that will move folks.
Not now. for Giant Zone.
Awesome. Thank you, Tim. Okay, so welcome back, everyone. I hope you enjoyed your discussions, and thank you so much for bearing with us with that brief tech transition. You know, you'd think after all this time, we would be just A+ at all of the technology, but learning every day. So well, I was just going to ask a few of our facilitators if they wouldn't mind sharing just, you know, maybe a couple of you a bit about what you discussed and if you heard anything that, you know, really you think the large group would benefit from hearing.
Yeah, absolutely. I'm happy to go first. Well, we could have talked for probably another hour because we were just getting to know each other. But really interesting to hear from folks coming from different places and their thinking around this and what their organizations are attempting to do. I think one of the key takeaways is everybody's identifying loneliness and social isolation as a mental health issue that needs to be addressed. And as we focus on mental health, that this is a component of it that we want to find solutions for. I think the other thing we were sort of talking about more toward the end, and we had people from Advocate Aurora, Sarah was from Advocate Aurora, Langlade Health Department, Donna came from there, Joey was from North Shore Health Department, Jake from the Walworth County ADRC, Kim was from the ADRC of Winnebago County. So we had this really great representation of folks from aging and disability resource centers and healthcare and public health. And I think, again, the key was everybody having this understanding that this is a challenge and really looking for some solutions. And I know we've had those conversations too. What does it look like? What do interventions look like? How do we reach people in communities? How do they present as lonely and isolated? And heard from folks, talking about, due to the pandemic, how much more time people are spending with people who present at an ADRC, for example, because they just want to have a conversation and they need some kind of human contact. So, I think that was Kim was talking about, how much more time they're spending talking to people just as a means of providing them with some kind of personal connection. So lots of different programming going on though. I mean, people have friendly visitor programs, are doing home delivered meals, recognize the connections that can be made through those things. And yet, as more and more people present in health systems and ADRCs and others, looking for what are some new additional kinds of strategies that we can share with people so that they can take folks from the next step from I'm lonely, I wish I had more connections, to something that would provide those connections for them. So it was a great conversation.
Great. Thanks so much, Chris. How about one more facilitator?
I can just join in. We had a nice group of varied population, from people working with children, people who had different abilities, and IRIS in the community, and a rural population. And it was just very interesting to see how there was very much a very person-centered approach, and people really working to help people set their own goals. And one individual was talking about mapping, connections, and helping people to see in their own lives who their connections are currently and how they can utilize what they already have to create that connection and a fuller life for themselves, and for the children to also help them to see who their supportive adults are and how they can create connection early in life and know how to empower themselves to live the lives that they want for themselves. So I think that's my big takeaway. And we had a rural community, and they're actually growing in how they're connecting just by the fact that a lot of people are actually moving out to the country, and then we're actually growing their program. So a lot of exciting things happening out there.
Wonderful. Thank you so much. Angie, I saw you pop off mute. Did you want to share too?
Sure. Yeah, we talked about some interventions actually. GWAR has done a leader training for a program called Healthy Ideas, which is specifically for older adults, one-on-one depression program. And we had that training the first week of November. So I'm happy to say there's 21 trainers out there within ADRCs, aging units, and a few healthcare systems. And then we're fortunate to have Sam from TimeSlips, I'm calling you out, Sam, talking about some of the programming that they're doing, creating more of a meaningful connection through open-ended questions and things like that. So very interested in learning more about that, and check out the website if you haven't. And then we had a gentleman on who had to jump off, but it was really interesting. He's a retired social work professor, and he creates documentaries. And so part of the documentary is going to be focused on social isolation and loneliness. And he was in Waushara County and happened to see a flyer yesterday and attended. So that was really cool to see. So those are just a few of the things that we talked about, but great conversation.
Thanks so much, Angie. And I hope for the Waushara County folks who are on the Zoom are feeling excited about that connection and that you recruited someone. So that's pretty cool. Awesome. Well, we just have a little bit left here, and then, we will wrap up early, and hopefully you can take some time to care for yourself and do something that feels good today. So just for the last few items for our time. So you might be kind of thinking, where do we go from here? And hopefully you learned a lot of different things going on throughout the state in your breakout rooms. But we wanted to offer you some other ideas as well. So of course, for folks who haven't joined the coalition yet, please do. You're always invited to join us. Another idea we had was, between now and the start of the new year, considering to reach out to one new partner or individual to talk with about this issue. So maybe you learned about how folks in the breakout rooms are approaching different partners in your community, and maybe you have somebody that's on your list. And you could make that one outreach and ask for a quick half-hour Zoom to talk about how you might collaborate together. And so that was, one idea we had for us as we come off of our awareness week this year. And while, our week is ending, we really hope that this end of the week is really actually the launch pad into what we will do next. And so as the week ends, it's just the start of where we will go. And, we need all of us working on this issue to continue to make this kind of impact in our state. And, we are interested next year also in featuring different things going on throughout the state. And if you are interested in sharing what you're working on, definitely reach out to me and we can think about how to get the word out. So we're really trying to build out that sort of network and understanding of who's doing what so that we can reach out and learn from each other. So that's kind of where we go from here. And I will stop sharing and just see if there are any quick questions. And while you think of those questions and maybe you drop those in the chat, I'm going to grab those few links that I mentioned that I was going to drop in the chat for everyone.
Carly, I would just mention, so I did put in the chat the link to the toolkit if people are interested in finding that. I should pop it in there again since we've come back and you won't find it now. The other thing is, for those of you who are just interested and you want to, sort of start simple, feel free to go to the Wisconsin Institute for Healthy Aging Facebook page. You can share some of those Facebook posts right from our page. So it's a simple way to be able to connect, folks from your constituent groups to some of that social media content and graphics. So feel free to do that, or come to the toolkit and download those graphics and share them out yourself. You can always, of course, put a link into your own agency or something else you want to connect folks to. So just a reminder that those are already out there and easy to link to.
Thanks, Chris. And I dropped links in the chat. Those first links, I know the formatting is a little bit funny. If you want to fill out an interest form, those are there. And then we've got an organizational membership agreement as well, if you're coming from an organization and want to join on that way. Hey, Ramsey, I see your hand raised. Go ahead.
Hey, I want to thank you guys for the hard work, and I want to tell people that anybody that's interested, People First Wisconsin has Zoom meetings every Monday from 4:30 to 5:30, and every Thursday from 6 to 7, and they also have a speaker series. So we would, if you want to go to the People First Wisconsin website, peoplefirstwisconsin.org. They're based statewide, but they've really helped me personally come out of social isolation. So thank you for your attention. Thank you. And I would like to find some more ways to help this coalition too. So thank you for that.
Awesome. Thanks, Ramsey. Yeah. So Ramsey was just mentioning that People First Wisconsin has some convenings, and Chris dropped that in the chat. So that's a really great resource for folks throughout the state. And that link should bring you right to the event calendar so you can get all that information. Awesome. Well, thank you all so much for the work that you're doing in our state. And I really appreciate our facilitators for jumping in today. We will get the recording out to everyone via our listserv, and definitely reach out as you're considering how you might want to get involved. And thank you for everything you've done this week to raise awareness around the issue of social isolation and loneliness. Have a great rest of your week.